Hello, everybody. Welcome to COSI Talks Live. We have quite the show tonight. We have 4 pages of questions. I was at AOPA this past week. That is the American Orthotic and Prosthetic Association's national conference. It's definitely the big to-do in the O&P world. It's where all the best of the best globally come to the United States, and they have this amazing conference. And I was very fortunate to be the guest of College Park Industries. It was my first time at the conference, and I was also able to present with John and Elisa to the two amazing prosthetists with College Park, and we were talking about their new microprocessor knee, the Icon. And again, it'll be now 8 years that I've been broadcasting the show and working with College Park. They have been supporting the show the whole time. And I got a chance to meet more members of their team. And that company does not fail to impress me. Truly, I wish I could give you guys a behind the scenes look of everything that they do in that company to serve this community, but truly a wonderful community. So I'm just going to say a quick hello to everybody here. We've got Tom on board. We've got Ham Sandwich checking in from good old Fort Wayne, Indiana. We got Cindy here drinking her Starry Zero, Dick Devers with his spring water, and Larry Acton with his tea. Good afternoon, good evening. Jim from Ohio and Earl from California. We got Scott and Emily coming in, as well as Mark. A lot of wonderful, friendly faces, and very happy to see you here, guys. I'm sorry I wasn't able to stream last week. As I said, I was at that conference. So, before we get started this evening, you might notice I'm not going to be my usual crazy, jolly Cuban self. We've had some interesting 2 weeks in our country, and today's events certainly have saddened me, and have made me really just wonder. For those of you who are familiar with Charlie Kirk, he was assassinated today in speaking at a university in Utah. And regardless of where you fall on the political spectrum, he was a very dynamic personality. And just, the events of today, the events of the past 2 weeks with the horrible shooting of Minnesota, the children at the Catholic school. Apparently there were also lawmakers that were assassinated in the past couple of days as well. The Ukrainian woman who was also killed in cold blood, and nobody came to her aid. Just a lot of things. And I usually, on the show, we like to keep it light, and we focus a lot on, the recovery from amputation. But there's just been a lot of events. And I think what particularly struck me when I looked at my Facebook and my Instagram feeds today that really made me sad was a lot of people's reactions to the events of today. People rejoicing in this particular man's death. A young man who now has a widow and 2 small children. And again, there are many people in this world, in our political system and activists and things like that I don't like and I don't agree with. But to rejoice in someone's murder, to me, is as evil as the murder itself. And it saddens me because I see many people that I consider friends and colleagues of mine, physical therapists, people who are called to bring healing to their patients, participating in this behavior. And it's not the first time it's happened. Unfortunately, we see this a lot on social media where someone has a bad diagnosis or a celebrity this or that, and you see people coming out of the woodwork rejoicing in these people's misfortunes. But it is a very sad note on our society. We are becoming a country and a society that has pushed God out of the equation, and we need to bring him back. Both sides, regardless of where you stand on the political spectrum, your beliefs, your morals. We need to pray. We need to bring peace into these situations. So it felt strange not saying something tonight. So I had to speak out on this one, and truly, my prayers go to that poor family and the families of everyone else who has suffered in these past 2 weeks with all these tragedies that we've seen on the news. So yeah, All right, guys, let's go ahead and we will continue. Like I said, I really miss it when I have to miss a show with you guys on Wednesdays. Um, so I'm excited to be here tonight to be with you all. I, like I said, I was at AOPA last week with College Park. I had the chance to meet with some new folks, meet a lot of new companies, and fingers crossed. I hope we see new supporters in 2026 for the COSI Talk Show. Um, Thank you. I appreciate that. Um, so I'm very hopeful for the future, and I hope to continue to see this show. It's become my ministry. It's become my vocation to keep it growing with the support from the O&P industry. But at the heart of it all, this is what I love doing most. I love connecting with each and one of you on Wednesday nights. I love hearing from you during the week, even when I'm not very vocal on social media. There are some weeks where I'm just so busy behind the scenes, I don't get to post very much. But I love connecting with you and hearing your stories and getting your questions and getting your feedback. So with that being said, and thank you all for your kind comments right now. I appreciate that. Let's get started. All right. So this question came in from Rick. He says, COSI, I just found your videos, really enjoy them. I've been a right above the knee amputee for 45 years and still very active. I have a rigid suction socket, which works well for me. My stump doesn't change shape, so it's always comfortable. As a peer counselor, I visit a lot of new amputees in Alabama, and there seems to be a real need for adjustable sockets, but I don't think they're offered here. Have you seen a lot of benefits to the Click Medical and Martin Bionics adjustable sockets? Rick, welcome to the COSI Talk Show. And yes, I am huge when it comes to adjustable socket technology in general. It was really starting to make a boom on the market when I started the show 8 years ago, and now it's a very commonplace thing to see. So yes, Rick, I think there is a lot of value in adjustable socket technology. I personally and professionally like the Click Medical adjustable RevoFit socket. It is the one that I am most familiar with. It's obviously they are sponsors of the show, and I've partnered with them for several years because I really like their product and because I like their team approach. I also like the company itself. It's a smaller company, and they really have a personal connection to the people that they serve. And there have been many times where some of you may have had an issue with something or your prosthetist had a question. I was able to connect you directly with the company and they respond right away. So that to me is also very important. When it comes to the adjustable socket technology, what I like about this is you can really have fine tuning of your adjustability, right? The limb volume is going up and down, especially in those first 2 years after your amputation. And it is incredibly frustrating to get that comfortable fit in the socket. Okay. So, to have something like this that can make those micro adjustments. And that's exactly, so this is my model socket. Okay. So this has a lot of stuff going on. This is not what they all look like. They don't have a lot of the dials. This is just because they put everything into one socket for me so I could demonstrate. Okay. But you can do forward and backward adjustments, especially with their newer Click Reel version. Okay. And make those micro adjustments that are more fine tuned than just adding or taking away a sock. Okay. And then if you live in a hot, sticky, humid, temperate environment like Florida, which is like we have 5 seasons and they're all summer, right? They're all hot. To not have to wear as many socks is a game changer for so many folks. Thank you, Earl. I appreciate that. So again, when it comes to Martin Bionics, that's another big player in the adjustable socket technology world. I don't know as much about them. I've seen a couple of patients with their particular, I think they call it the socketless socket, and I've worked with those patients. And again, it does require the skill of the prosthetist to know how to make that. Okay. So, a lot of it depends on the skill of the prosthetist. Either way you go, whether you go Click Medical or Martin Bionics. Okay. As I said, I worked with Click Medical, so I know that they have a lot of education on their website through their Click Academy for their professionals, and a great support system. You need to do what works for you. Okay. At the end of the day, you are the one waking up with the foot, the knee, the socket, the whatever. Okay. And there are some patients that they come to me and they say, look, I think Click Medical is great, but I prefer the Martin Bionics socket and how it fits. And then I have the opposite. I have some people say, nope, I don't care for Martin Bionics. I want to wear Click Medical. If it's comfortable, functional, and working for you, go for it. Okay. And yeah, I think it's a good conversation to have. And I say this all the time on the show. Do I think everybody needs an adjustable socket? No, I don't think everybody needs an adjustable socket. Do I think that everybody would benefit from having that conversation with their prosthetist? Yeah, have that conversation. Have that conversation. Hey there, Josh. Hey, guys. Thank you again for your kind comments. I appreciate that very much. Very much. Thank you. And this is why I love doing this show. Okay. Okay. Here's another good one. This one said, "Hi, Kosi. On one of your shows, you mentioned a brand of products for cleaning and moisturizing the residual limb, but I didn't write down the name correctly. It was something like Vita something." Yes, it's called Vital Fit. I'm going to write it down now. Vital Fit. And if you look it up, if you just Google Vital Fit SR. I don't know what the SR stands for, but that's what you have to like put it into Google. So this is a company. Yes, Mark. Mark brings up an excellent point. He says, to be fair, when I got my Click Medical socket, the insurance codes were just approved. So check with your prosthetist. And yes, that was a huge victory for Click Medical. And we actually did an entire show on L codes. Like, what's the L code? Why do you keep hearing that buzzword from your prosthetist? It has to do with the code that your insurance looks at when your prosthetist bills the insurance for your prosthetic componentry. It's assigned a certain L code. So if a particular prosthetic component does not have its designated L code, it is almost impossible. Not impossible. It's really, really hard to get it approved by your insurance. And a lot of denials come from that. So the fact that Click Medical was able to get an L code for their RevoFit system is huge, huge. Okay. So then going back to the brand of products for skincare, we do so much emphasis on skincare and hygiene here. Again, your skin is never going to be the same once it's sitting under a socket all day long. And even those of you who have osseointegration, you have your skincare hygienes and regimens that you need to prescribe to and take care of, right? So Vital Fit, as far as I know, is the only company that produces products specifically for prosthetic users, right? I used to recommend a lot of over-the-counter lotions and potions and things like that, but never something that really worked. This was the first company. I partnered with them for many years. Unfortunately, they downsized a lot and they're moving in a different direction. However, they are still producing the product. Okay, so some of you who were like trying to find their website and you're like, what's going on? Things look different. You can still get their products. And then again, keeping in mind 2026, I am hoping to be able to really ramp up our skincare and hygiene and education portion on our show. And I'm going to leave you with that. But in the meantime, go ahead and go to the Vital Fit SR. And then my code, apparently I spoke with the company the other day. My code still works. It's COSI10. So I believe it's $10 off any purchase of $20 or more. So, that's a nice little chunk of change you can save there. So go forth and try it out. Wonderful products. All right, next. You know what? And I haven't said hello to my Instagram folks. Because I have to go to a different screen for that. Okay, sorry, Instagram. I was not very good about whoops, there we go. Okay, back to here. All right. This text message came in and it said, at times when removing the liner and socks, I will have a slight rash on the front thigh, not the nub area. That itches. Is it all right to use hydrocortisone? I don't want to risk scratching and possibly opening the skin. Okay. So when it comes to rashes and things that happen when you're using a prosthesis, this is very common, guys. At some point in your life as an amputee, even those of you who have the most resilient skin, at some point you're going to run into something, whether it's a blister, whether it's a breakdown, whether it's some kind of a rash. And my goal is teaching you guys to understand that you always need to figure out, first of all, what it is that you're dealing with, okay? Especially when it comes to these rashes, okay? Is it a fungal rash? Is it a heat rash? Is it a bacterial rash, okay? Because how you treat it is going to be really different, okay? So if you kind of keep getting this little irritating rash, like what it sounds like for this person, it sounds like, it's the skin that's hot and bothered and irritated. The problem with applying hydrocortisone over and over and over again is that over time, it'll actually degrade the integrity of the skin, and it will backfire on you. Okay. So I'm not against using hydrocortisone, especially if it's all really itchy and you just don't want to scratch your skin off, if it's appropriate to use hydrocortisone. But by the same token, you need to, again, go back to, why is this happening? Why do I keep getting it in that area? Okay. A lot of times, again, because we live in Florida and sweat is just a natural part of what we do here all day, all year long. A lot of times sweat can also cause that irritation, and it can be a little bit itchy and irritating. Again, everybody's skin will present a little differently. So what I tell my Floridians to do, and anybody living in a hot environment, is making sure that you're taking your leg off at least once a day and cleaning it. So my favorite recommendation is to have a little spray bottle that's half alcohol, half water, okay, a diluted solution. Shake it up. You spray your limb, dry it off, spray the inside of your liner, make sure that is nice and dry, and then reapply everything. Now, again, if you live in a place like Florida, you might find yourself doing that more than once a day. It's when you feel that sweat. Okay. So yeah, sometimes that sweat can just irritate a spot and make it itchy. So when you take your leg off, your leg is just kind of itchy. Okay. I know that sometimes, like when I go for a run and I sweat a lot and I come home and, if I don't take a shower like right away, then just the skin just feels itchy from the irritation from the sweat. Okay. But most importantly is figure out what it is first. Okay. Make sure you don't, for example, make sure you don't have just a little bit of a fungal infection right there or a yeast infection right there. And then figure out the why behind it. Okay. And that's going to help you tackle it. All right. Next. G.I. Jane says, "Hi, Kosi. Darlin, I was wondering about a detailed explanation of care of PT after OI stage 2, part 2, any prep that I can be doing now to enhance a better outcome for stage 2. Okay, that's a show in and of itself. And we've done lots of shows on osseointegration, specifically the Oprah implant method, which is the one that's FDA approved here in the United States for above the knee amputees. Now, when it first came to the United States, Walter Reed, big cool military hospital up north, they were the ones that were pioneering. Larry, did you just say whiskey with water? I have never heard of whiskey with water as a treatment for skin. We're going to have a talk about that one later. Anyways, so when it comes to the osseointegration, Walter Reed was the first pioneer here in the United States to bring this here. And they established what is known as the Walter Reed protocol. I know it's very creative, right? And they base their protocols on the research that has been going on since 1990 in Sweden. And that's where the surgery originated. In Sweden in 1990 by Dr. Brannemark. He's been on the show. Go check out my YouTube channel. You can watch all those shows later. Okay. So they base the protocol. What do I mean by protocol? So the osseointegration with Oprah is a 2-step procedure. Okay. The first step is where they put the implant into the bone. Okay. And then the second procedure is when they create the opening where the abutment sticks out, and that's where the prosthesis is attached. There are very strict guidelines because they have to preserve the integrity of the implant. And then they also have to make sure that the opening that the surgeon creates in the skin heals properly. Okay. And it's very, very strict guidelines. And then as the person starts to put weight into that implant, there's also strict guidelines there. Now, when Oprah was FDA approved in 2020, okay, we had that protocol. 5 years later, and it's really not a lot of time, the surgeons here in the United States, and you guys have seen many of these surgeons on the show, some of the top surgeons, in my opinion, in the world that are doing these procedures, they're starting to learn and evolve and change some of these protocols, not radically change them, but make tweaks to these protocols. Okay. So I guess my really long-winded approach to this is, and G.I. Jane, I know you have a fantastic surgeon who's doing your OI because he's been on my show. He's a fantastic surgeon. Follow what the surgeon tells you. Okay. So even as a physical therapist, I have something like the Walter Reed protocol that I base treatment for OI patients. However, if I have a patient with OI, I'm in communication with that particular surgeon because they are the ones who know the integrity of that bone, of that person's bone. They are the ones who know how that skin was attached specifically. Okay. So I go to them with the protocol and say, is there any adjustments that need to be made and how can we customize it to this patient? Okay. It truly is something that you have to have patience. And I know that's hard because it is a long rehab process to have patience. But if you have patience and you work specifically with your surgeon, that's where you're going to have the best outcomes and the rest of your team as well. All right. Next, Bill asks, are you a fan of copper or silver infused products? Yes. So for the longest time, we hear about silver. By the way, guys, cheers. Right. We hear about silver and its antibacterial, antimicrobial properties, that it's used a lot in wound care, right? To help with wounds and to help kill the bad bacteria in the wounds and to help not kill, it's selective, right? So it kills the bad stuff and doesn't harm the good stuff. And then when I was in Poland last October, by the way, guys, I get to go again and I am so excited. Joan, darling, where have you been? Oh my goodness. It is so nice to see your name up there. And I'm sending you a big hug right now. It is so nice to see you. I have not seen you in a really, really long time. Thank you for being on the show tonight. Okay, back to our regularly scheduled program. All right. So when I was in Poland last year, it was this wonderful international amputee forum, and they had people from all over at this forum in Krakow. And I'm so honored that I'll be able to go again this October and speak again at that conference. And we had there was one researcher who came in, who flew in from Israel, and they had done a beautiful job, a beautiful research study using copper. And that was actually kind of the first time that I had heard about copper being used in wound care. And it was fascinating. I did wound care for many years. I haven't done wound care in a while, so that's probably why I was a little bit behind on the copper. But it was fascinating. So I think there is certainly a place for it in skin care and wound care. And I'm eager to learn more about those studies. So yeah, I'm definitely open to hearing about them. Okay. Sorry, guys. I know I'm like kind of talking fast, but we have so many questions, and some of these questions were left over from 2 weeks ago, from before the conference. And I want to make sure that folks get their questions answered. Okay, here's another good one, guys. And this is one where I need your feedback. This one is from also GIJ, and she says, I scuba and would like to ask fellow watchers, what foot do they think is best? So my snorkeling and scuba and water and fish people, go ahead and start putting in the comments section, what do you use? So I know that once upon a time there was, unfortunately, let me just check over here. All right, hey guys, from my Instagram folks, don't be shy about giving some comments and showing me some love. Okay, so once upon a time, there was a company that was kind of sort of making a flipper foot, and unfortunately I don't think that his business was able to continue. I know that there are certain attachments, and I've seen this where they put an attachment at the bottom of the socket and then they put the flipper there, not necessarily with a pylon, like it was just stuck to the end of the socket. So like the flipper was somehow stuck here and then the person was able to use the flipper. Honestly, to be really honest, the majority of people I know that do snorkeling and who are amputees, they just put a flipper on their sound limb. They don't necessarily use a flipper on their amputated side. And I think like when people were talking to me about it, they just said it was kind of a bit of a pain in the neck, like getting in and out of a boat, trying to manage that and maneuver that. But again, I want to hear from you guys, like those of you who do. I wish Mark were here because he's my big snorkeling guy, so that he could comment, but he's probably off watching a game somewhere. That's usually his excuse for not coming on my show. All right. Okay, so here's one from Jim. Jim says, okay, I lost my leg about a year ago due to an accident and suffered with phantom pain for the first 3 or 4 months. Haven't had it since till I watched last week's show about phantom pain. I'm so sorry. And I've been having a phantom itch in my leg all week long. I guess the mind really is a powerful thing. Yeah. And again, this is probably why we're behind on questions, because we got stuck on phantom limb pain last 2 weeks ago. And yeah, that's a lot of information there. He says, I'm in the process of being fitted for my first computer leg. Along with that will come a new socket. I've had so much stump shrinkage in the last 4 months, probably more due to the weight loss than anything else. I'm a little bit concerned that this socket will quickly become too large. Is there a point where even with weight loss, the stump stops shrinking? Say that fast 3 times. Should I wait a little longer to get the new leg? I'm afraid Medicare will quit paying for new sockets. This will be my 3rd socket in a year. Any suggestions? Yes, Jim. First of all, Medicare, if your prosthetist is doing the paperwork properly and writing for the medical justification as to why you need a new socket, they will continue to pay for it. I've heard of people who have as many as 7 to 8 sockets in 1 year, and that's a normal part of the recovery process. Okay, so yes, and you're pinpointing a lot of things. Your weight loss is certainly going to contribute to the stump shrinking. And then also in those first 2 years, everything is remodeling in your leg. I did a series of videos for Click Medical, and it's actually on their website. I need to create a QR code so you guys can go listen to those videos where I explained the whole process from like day 1 after surgery all the way through 2 years and beyond. Like, why does your limb keep shrinking and remodeling, right? So the short answer is, will your limb continue to change throughout your life? Yes. Why? Because our bodies are dynamic. Our bodies are not the same from one day to the next. Okay. Now, ideally, the majority of the shrinking occurs in those first 2 years. And then after that, hopefully you will start to see stability in your limb. And that can look differently for everybody. Okay. Stability doesn't necessarily mean that your limb stops shrinking. It just means it becomes predictable. Okay. So for example, you'll wake up in the morning and maybe you have a little trouble getting into your socket and you do the amputee dance to get into your socket. And then as the day goes on, you might progress to 5, maybe as many as 10 socks by the end of the day. And then at night, you put your shrinker on and it resets the clock and you start the same thing the next day. You're able to predict what your limb is going to do. Now, there's the occasional unicorn out there, and I've only met like a couple of people that their limb never changes. And I seriously want to know what's going on with their genetics and DNA that happens, right? But the majority of people, yes, there's going to be changes. And this is something that it becomes a part of who you are, right? The same way you learn the habits of personal hygiene. This is one of those habits that you learn. You learn to manage your limb volume. And this is where you continue to have conversations with your prosthetist, continue to have conversations with your physical therapist on how you can stay on top of that. Okay. And I promise you, it does get easier over time. It does get easier over time. Joan says, I use CBD oil for phantom pain. I rub it around the area where my nerves are, and I'm a right BK. Sometimes I have to do 2 doses of the oil, but it works for me every time. And it's funny with all the CBD products. And again, I keep saying I'm going to go do more research on it. And like some of you have even sent me email messages saying, Cozy, go do more research on it. Go learn more about it. And I really do. But yeah, in general, I hear a lot of that from you, from many of you, that the CBD oil does seem to have a positive effect in helping relieve some of that phantom pain. As always, though, keeping in mind that does soak into your system. It becomes systemic, which means you need to check with your doctor to make sure it's not interfering with any of your medications that you could potentially be on or some other vitamins that you're on. Okay. Let's see. Robert says, I am a unicorn. One of the unicorns. What is your secret, Robert? Teach us your ways, Obi-Wan Kenobi. What is your secret for keeping a limb volume so stable? Mark says, I was up to 26 layers at one point in my first socket. Bless your heart. Yeah, no, 26 layers, no bueno. No bueno. No bueno. So I'll just add the caveat to that, guys, that the textbook will tell you when you get to 15 socks, you need to get a new socket. For me, it's when your socket starts to feel disconnected and you start having issues feeling connected with your socket. Some people, it's as little as when they get up to 8 ply, they can't feel their socket and it's driving them bonkers. Other people like Mark, holy smokes, going up to 26 layers, although I can't imagine that could have been a comfortable walking for you during that time. I don't recommend it. Obviously, the less amount of socks that you have to wear, the better connection you're going to have with your socket overall. Hey, Benny. Benny is so cool. He sends me like really cool songs. And some of these songs that I love and some of these songs I've never listened to, but I always appreciate his messages. Robert says, I think because of lean muscles, I was never a big bulky guy and I had lean muscle prior to amputation. My guess. That's a great guess there. And guys, yeah, you hear me talk about it a lot too. What happens after those first 2 years, a lot of that will depend on you, right? How well are you keeping your medical conditions under control? Specifically your glucose, diabetes, your blood pressure. Do you have kidney issues? Some of this, sometimes even with the best of medical care, you may not have control over what happens, but you can control your diet. You can control your hydration. You can control your exercise habits. And all those little things come into play when it comes to managing your limb volume. Steve says, and I thought 1920 was high. Oh, 19 to 20 was high. Okay, got it. Sorry. No, Steve, I think that's the record. I think 26 is the record. Last one I heard was 25, which was insane. Yeah, Mark, I would have been mad at you too, man. Are you kidding me? Especially an active guy like you. Okay. Here's a good question. And honestly, if I would have had time at the AOPA conference last week, I wanted to go live just to answer this question because I had some amazing prosthetists with me. The text question asks, what is the right microprocessor knee? Yeah, we need to do a whole show on that. And again, there might be a show next year, a new show next year. That could be really amazing where we discuss like just all about microprocessor knees. Ooh, hope that one comes through. Hope that sponsorship comes through. Anyways, when it comes to choosing the microprocessor knee, it's just like very similar to how you choose your microprocessor foot. You need to determine what is it that you want that knee to do for you. Okay. Do you want it to be able to take you through your everyday work job where you're walking up and down hills all the time? Do you need it to leap tall buildings in a single bound? Just kidding. Are you chasing after kids? Do you have a desk job? Okay. You need to look at your lifestyle and your mobility potential. And again, this is where I'm really, really adamant about having a physical therapist help you with this input. Okay. Love me, my prosthetist, right? But the physical therapist is the one who can really, really help you determine what is your potential mobility down the line, right? We don't have a crystal ball, but we can get pretty good at pinpointing this is where you will be how you'll be reasonably moving around, whether it's with a cane, whether it's independently, with a walker, whatever. Okay. And based off of that, you can determine what kind of a knee do you need. Do you need a knee that has more stability? Do you need a knee that needs more mobility? And again, the alignment of the knee and how they align the knee will also play a big role into this. Okay. Are you someone who needs that stance stumble recovery, right? Something that will stop you from falling. And a lot of our knees now, we're starting to see that from the K2 knees to the K3 knees, which is a really wonderful thing. Okay. Maintenance. There are some knees that require a lot more maintenance. Like there's total divas. They're like diva knees. And then there are some microprocessor knees that are just a little more simple. They're easier to program. They're more user-friendly. Okay. And they work great. There are hydraulic knees. We have polycentric knees. There's all sorts of different knees, but it boils down to what do you need this knee to do for you? Okay. And where are you with your mobility and where do you reasonably expect that you're going to be? Let's see. Randall says, I'm at 23 layers. I go in on Monday to start the process for a new socket. Really, Randall? Monday? Darling, you should have been in there like 2 months ago. I'm just playing with you. I'm just messing with you. Let's see. Ham Sandwich says, my 4-month-old socket is a first-time suction system with a Revo click door on either side. I didn't work so well being casting and deliveries tomorrow. Getting back to 0G gate for next week. 0G machine. So many questions. I'm like trying to fiddle. Okay, here's a good one. This one came from Mark. Mark said, as I have said, I am completely satisfied with my Revo Fit socket, utilizing the seal-in ring liner suspension system. But being an engineer, I constantly struggle with what is best for my situation. I'm wondering about the pin lock systems or lanyard and maybe the hybrid of those with the Revo lock for my next socket. I have to have redundancy. So of course I will have a conversation. My question is, how fiddly is getting the liner aligned when donning it with the pin and lanyard type liner? Okay. With seal-in or suction, perfect alignment is not completely necessary, but it would seem to me that with others, you have to get it perfect. And you're absolutely right, Mark. And let me just see. Hang on. Here we go. Okay. Ta-da. So here is a pin lock liner. Okay. And this is not the socket that it goes to. I'm just going to kind of use it as an example, right? So when you have that pin lock, right, it goes in, it goes through a little hole on the bottom and it goes click, 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 click. So Mark, you accurately stated that if the liner is not put on perfectly, right? Let's just say, the person they put their residual limb in, okay? And let's just say that it's a little bit further up like that. Then when they put the liner in down, it's going to create this weird lump here, and that's going to create pressure and discomfort. Okay, and I'm trying to exaggerate it so you can see it on the video. This is probably not the best presentation right now. But yes, that can happen. And that's honestly one of the more frustrating things, that when my patients are first learning to put on their liners, because, these things are not easy to put on, right? This one's already stretched out and I'm having trouble with it, right? You gotta go all the way out, right? And then put this at the end of the residual limb. And then I'm holding the pin on the inside, and you gotta put it on the end of that residual limb. And because you can't see the pin, you have to kind of go by feel. Okay. So yeah, if this is the end of the residual limb and you put it a little bit too much this way, it's going to throw off the fit of the socket when you click into it. And then you have to take off the whole thing and start over again. You can't just like jerk it around like that. You have to take the whole thing off. And it's frustrating. And it happens to my patients all the time. And a lot of times, sometimes I've even had some patients that they won't tell me and they think I won't notice, but I'll notice them like in the parallel bars and they're doing like this little funny dance. Like, when you got your underwear in the wrong place and you see they're going like this, and I go, your liner's not put on right, is it? And they're just like, because they know I'm going to make them sit down, take it all off, and put it on properly again, right? So yes, that is one of those things. That being said, Mark, that shouldn't deter you from trying out the pin lock or lanyard system if you think that that's going to give you the suspension that you need. It's just practice. It's practice. And again, you just have to be diligent that the first times that you're using it, that you do take the time to put it on properly and take it off and put it back on if you didn't do it properly. Okay. And you eventually get the hang of it. Okay. Let's see. Pat says, hey, Kosi, now from the South Shore of Massachusetts, maybe not a unicorn, but I've been very fortunate with limb volume, lots of walking. Also as an AK, when I swim, it's with no prosthetic. Just feels very freeing and very comfortable. Wearing a neoprene swimsuit also helps a bit with buoyancy. So yeah, and Pat, you're an incredibly active individual. And yeah, guys, I don't need a fancy research study to tell me that the healthier the individual, the more stable their limb volume. Okay. And I tell my patients, just because your limb was amputated does not mean that the diabetes was amputated with it. Right? The statistics are flat out sobering of the rate of incidence of people losing a second limb within first 5 years after their first amputation. Okay. So again, really jumping on your medical conditions, right? Working with your team to get them under control as much as you possibly can, at least whatever is within your control. Okay. It makes a difference. It makes a difference. Okay. Let's see. All right. Shell here sends a question. She says, I've been a left BK for 2.5 years now. Since the start of using my prosthetic leg, I've had severe pain and numbness that radiates from my hip to behind my knee. It's bad that I have to stop and remove my prosthetic leg to find relief. My research tells me the likely culprit is a compressed femoral nerve. Do you have any exercises or advice and et cetera, et cetera, et cetera, to get relief from this? And then I had some follow-up questions for Shell, and she indicated that, she's had workups done and MRIs and nothing seems to be coming to light. Okay. So, here's the thing. When you're on the right track, right? If you're having pain, severe pain and numbness and that radiating feeling, that's certainly nerve type symptoms. Okay. That usually indicates, something with the nerve is not right, but it's not going to be the femoral nerve. It doesn't seem like it from the way it's being described. Okay. Come here, Bob. All right. So just super, super quick anatomy lesson. Okay. Your femoral nerve, it originates, you got your spinal cord sitting here, and the spinal cord has all these little nerves that spit out from there, right? So from L2, 3, and 4, it's been a minute since I've done anatomy. You have 3 nerves that come out and then they form the big femoral nerve, and it comes through the front. Okay. And it comes down through your leg and it sprouts out and does all sorts of fun things, right? but it controls like the hip flexors and your quadriceps, so the front part of your leg. So if you're feeling the numbness and the pain in the back part of your leg, that's not necessarily where I'm going to think femoral nerve. Okay. And then again, usually, if you were an above the knee amputee, then I'd be like, okay, what's going on? Because you have a socket coming up the front part of your hip. So that could be pushing on things, and that could be a femoral. But as a below the knee, you don't have anything here that's necessarily compressing that nerve from a prosthetic standpoint. What is a more common issue is from the behind and your sciatic nerve, okay? And that is a very big, fat, juicy nerve that can cause a lot of problems, specifically if you have a tight piriformis muscle, okay? So another quick anatomy lesson. Sorry, Bob. All right. Underneath the big glute muscles, you have lots of little things going on, but specifically you have a tiny little muscle called the piriformis muscle. It's literally the size of like your two fingers. It's not very big. Okay. And especially when you take into account the size of the sciatic nerve, which proportionally speaking is going to be the size of one finger. So the piriformis lies on top of the sciatic nerve. Now, if the piriformis muscle gets tight, it's going to start to compress the sciatic nerve. And a lot of amputees have this problem. A lot of non-amputees have this problem. And you get that radiating pain and numbness down the back of your leg. Now, is that what's going on with this particular person? Nope, because I don't have this person in front of me to do a proper examination. But I think that might be something they need to look at more. Okay. Now, why would the piriformis get tight? Y'all know that I like going to the root cause of problems, right? I don't like just saying, oh, it's this. It's why. Always ask why, because that's what's going to gear you to getting a treatment and hopefully successful outcome. Why would your piriformis muscle be getting tight? A lot of times it's because the muscles around it aren't strong, the glutes, right? And this might sound like I've said this before, but because I have. A lot of times amputees will have weak gluteal muscles or gluteal muscles that are stressed out because they're having to pick up more of the slack since the lower leg muscles aren't there anymore. Okay, so one of those presentations can be piriformis gets all spazzy and starts pressing up on that sciatic nerve. Okay, now this particular person does not have access to an amputee specialist, but you don't need an amputee specialist to tell you if you have sciatic nerve issues. That's a very common thing to see among the human population. A good, solid orthopedic physical therapist is going to be able to identify this and give you successful treatment from it. Okay, now the other interesting thing that when this person, when she wrote this to me, is she said, I have to take off my prosthetic leg to get relief. So again, that puts the bell in my head going, well, does this pain only happen when you're wearing your prosthesis? Is it immediately relieved when you take your prosthesis off? Okay, so again, asking these detailed questions about the nature of the pain, what brings it on, how long does it last, how do you get relief from it? Okay, again, helps us figure out the root cause of that problem. And it could be a combination of both things. It could be that, yes, she's getting sciatic nerve compression back there because of a tight piriformis, and there may be something in that prosthetic socket that is also kind of like compressing on something and getting it hot and bothered there too. Okay. All right. Emily says, but once you're clicked in, which is nice. And she's referring to the pin lock system, suspension system, which is true. And again, that's the majority of my patients who use the pin lock or the lanyard system. It's because they like having that security in there. Let's see. Emily says, I need to lose some extra weight or fluid in my upper thighs. Any exercises you can recommend? It's hard with spina bifida and not walking yet. My thigh corset on my prosthesis is too tight right now, so I can't wear it. So again, Emily, someone like yourself who has chronic lymphedema, the wrapping, and staying on top of that and working with your lymphedema specialist to help make sure you keep that under control. Especially if you're wearing a thigh corset, again, that thigh corset can cause a tourniquet-like effect. So this is something where you, your prosthetist, and your physical therapist need to work together and perhaps think outside the box in terms of what is a solution that you can do, whether that is possibly wearing a compression garment underneath that thigh corset to help minimize that tourniquet effect. Doing the lymphatic massages that hopefully your therapist has shown you how to do by now. Okay. Because as you know, if you have chronic lymphedema and those lymph nodes are not being pumped and primed, then they can't siphon out that fluid. It just gets stuck there. Okay. So that's something that you may need to also look into. And again, when it comes to managing chronic lymphedema, it's not just one thing, it's doing all of the little things to get a more stable solution. As far as exercises, again, if you want to try to use your muscles as a pump, I would recommend quad sets, ankle pumps, or in your case, you can't use the ankle pump. Excuse me for that one. The quad sets, the hamstring sets, and the glute sets. Okay, and those are all the basic exercises and the first exercises in my Cosi Talk Strong Body program. Okay, so that's something that you can start to do to help pump the fluid out, along with the lymphatic massage and talking to your prosthetist about how can you adjust the fit there. Make sense? Okay. Oh, here was a nice message that came in today. And guys, by the way, now that I have you here, let me do my PSA. If you are not already on my texting service, guys, please, 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 it would mean the world to me for you to be on it. It's something that I know my sponsors like to see because it's a wonderful way to engage with you. It's a way that I can send you the links to my show when I go live. Those of you who have been on my texting service, you know that I don't send spam. I don't sell your number. I don't do anything crazy like that. I respect your phone. And then also you have the chance to text me your questions directly. Okay. So if you haven't already done so, please sign up for my texting service. You text Cosi Talks, all caps, one word, just right there to that number, and you can start communicating with me right there. Okay. Let's see. Randall says, my doctor just told me I have a compression fracture from a recent fall on my buttocks. Do you have any advice in getting back to normal? Oh, okay. I need a little more information, Randall. What kind of compression fracture? Is it in the vertebrae? And have they given you treatment for that yet? Robert says, I had a great interaction with a child this week. She asked if my leg is a ghost. I said, no, it went to heaven to put my foot in the door so I can get in. Oh my gosh, that is the best answer ever. Oh my gosh. That is the best answer I've ever heard, Robert. Bravo. I love that. I love that. Robert, oh my gosh, guys, I finally got to meet Robert Shulman in person. He is the founder and the brainchild behind LimbKind Foundation. They are just an amazing outreach mission program, bringing prosthetic hair to the far-flung edges of the world. And one of these days, Robert, we're going to make the stars and the moon align, and I'm going to go on a trip with you to one of these amazing places. But Robert, go ahead and throw up the information for either social media or website, whatever it is that you want to do so people can go check out the work that you do. LimbKind Foundation, guys, really wonderful, wonderful organization there. All right. This was a text that made me smile. Jim said, you said you would like to hear our stories on our journey of amputation a few shows back. My church did a video podcast on my accident back in the spring. The podcast is almost 30 minutes long, so you may not want to take that much time out of your day to watch it. I will. I would be glad to write something up if you would prefer. I think this is a great idea about sharing our stories, and I think it can be almost therapeutic. Just thought I'd throw this out there and have a great day. Jim from Ohio. Yes, Jim, I've said that on many occasions. I think one of my favorite things about being a therapist is not just the therapy part of it. It's my interactions with either my patients or you all as my viewers in hearing people's stories. I think my favorite time for this was when I worked home health. I worked home health for 8 years. And, getting to treat people in their home, it's very different than treating people in a clinic or even in the hospital setting. You get a really personal view to their lives, obviously. And with that comes a lot of beautiful conversations and hearing people's stories. So, Jim, I am trying to figure out how I can work that more into the show for next year. So stay tuned and please send me the link to the video podcast because yes, I would love to drink a cup of coffee and listen to that podcast. Okay, Robert put up the information for his Limkind Foundation. No, it was an absolute pleasure, Robert. Let's see. Randall says, I had a CT scan yesterday. We'll know more after the Friday doctor appointment. Okay, so Randall, again, when you have fracture of anything, you really need to take care of that bone. That is the first priority right there. And I know that sounds like master of the obvious, but I see sometimes where people don't take a fracture seriously enough and it doesn't heal properly and they have chronic issues down the line. So again, depending on what the CT scan says about the kind of how severe the fracture is, if it's in the lump, if it's in the vertebrae versus wherever else. I'm assuming it's in vertebrae. If you fell on your bum, then the compression fracture, I can see where that might happen in the lower vertebrae. There are different treatments for that. So getting that treated and getting that stabilized and getting it healed is the first priority. And that might mean putting off the mobility for a little while. So you may not be able to be very aggressive with your mobility, and that's okay. It's something that you can get back. So again, feel free to send me an email or send me a text message. Let me put my email up here for you guys. What just happened there? I typed in something I don't know what just happened. What's my email? My email is cosi@cositalks.com. Okay, and guys, this is for all of you. I didn't do my formal introduction at the beginning of the show, but this show is for the amputee community. So it's you as amputees, those of you who are clinicians treating amputees, and the caregivers and family members. What is going on with my screen? So again, the texting service is the best way to communicate with me. Also, you have this email that you can also contact me at. But I guess, Randall, once you know more information, then I can make suggestions a little bit better at that point. So here we go. We got, guys, I need information from you guys on this one. This is Chuck from Wyoming. Chuck says, we are considering flying to our next prosthetic appointment. I have not flown with a prosthetic leg. We've heard all the horror stories about flying and TSA. What do you or any of your viewers know about flying? Is it worth it to get the TSA Express Pass? Just for reference, it is a 12-hour drive one way to our prosthetic appointments. Flying would cut the trip to 4 hours, 2 hours in an airport and a 2-hour flight. So again, I would really love, I wish Jeannie were here because Jeannie has a lot of experience with flying. I've heard everything across the board. I've heard the horror stories from TSA, and I've heard some people that they just breeze on through. Again, I am not an amputee, so I cannot relate in that regard with TSA, but I travel everywhere with my 4 kids. I now used to travel with them when they were super, super tiny. All 4 kids, even on one occasion by myself, through TSA checkpoints, security checkpoints with 4 small children, each of their backpacks, whatever equipment I needed. And there were some TSA experiences that were much more pleasant than others. And we'll just leave it at that. The best recommendation I can give you, get there early. Get there with enough time where even if they hold you up for whatever reason, they decide to hold you up, just get there with plenty of time so you don't have that anxiety of, I got to get going. Get there with plenty of time. So here, thank you guys. Glenn says, flying is usually easy. Sean says, ask for a wheelchair and you will bypass TSA. Another thing I would recommend, especially if you have a smaller airport, or if you have a choice. So for example, where I live, I have Tampa International Airport, which is huge. And it's actually one of the best airports in the country. It's actually a very friendly airport to go through. But then we also have a smaller airport, the St. Petersburg Airport, and it's a smaller mom and pop airport. And sometimes it's a little bit easier if you have a choice to go to the smaller airport because it's a little bit, not that they let anybody in, but the lines aren't as long and TSA agents might be a little bit more relaxed about letting you do it. And Glenn says, if you're not sure if you can walk, use the wheelchair service. That for sure, especially if you're not sure if you can walk the long distances from one gate terminal to the other, or if you have a connecting flight. And then the other thing is call your airport. In anticipation, again, an ounce of preparation will save you a lot of heartache. Call the airport ahead of time and just ask them, hey, this is what I have going on. What do you recommend? Every airport is definitely different. I can tell you that much from all the different airports I've been to. Robert says, I always use a wheelchair while traveling on planes and cruises. Okay. As far as the actual TSA guys, if you guys can give me any input, I think, again, sometimes you're at the mercy of whoever is the TSA agent. Most of them are pretty good, but sometimes you might get one that's a little bit cranky and hasn't had their morning coffee. But just explaining to them, this is what I have, and just have something on that you can show them your prosthesis. If you are in fact walking through, something where that you can either roll up the pant leg, or if you're wearing shorts where they can easily see it and easily access it if they have to do the sweep of it, whatever they have to do. See, and Glenn just said, wear shorts, they'll swab your prosthetic and it takes a few minutes. TSA is usually very polite and kind. Yeah. And again, guys, I've heard some horror stories, but the majority of things I've heard is not a problem, and get there with plenty of time. Marianne says, I've never had any problems going through the airport. They are so nice most of the time. I've never had a problem. Actually, in our small airport, they let my sister come clear into the plane with me. Wonderful. Robert says, TSA has always been helpful and quick. Yeah. And I think there's been a big change since from a few years ago. I think we're just in general in our culture, whether it's pop culture, whether it's in advertisement and movies, we're seeing more amputees out there and represented. So I think just general awareness has also come a long ways. So I like to think that that's also playing a role in trickling down into things like TSA. Robert Shulman says, domestically, they aren't allowed to make you take your prosthesis off. But do know that internationally, they don't hold the same laws. Yes, now that you mentioned this, I have heard this. Depending on the country, they might make you take off the leg and put it through the machine, but be prepared to go into a small room and have your things with you to don and doff your prosthesis. Yes, and unfortunately, there was a friend of mine that she had, unfortunately, a very negative experience in an international flight. Well, because she was not expecting that. So yeah, I would definitely say if you're an international, you're on their terms and their rules are going to be different than our rules in a lot of things. So again, becoming familiar with wherever it is that you're traveling to, calling the airport ahead of time, and giving yourself enough time to really just take it easy there. Okay. Okay, so this was a very interesting question. I had never received this question. This question came in from Jerry Ann, and she was asking about how is it for an amputee to do CPR? And I had to send a follow-up question because I was like, well, do you mean an amputee performing CPR on another person, or an amputee receiving CPR? So she clarified that for me, and she said, yes, what I meant was, me doing CPR on another person. She says, I'm a bilateral below the knee. How would an amputee perform the CPR on someone else? When working with children, it's essential to be proficient in CPR. Agreed. One of the practical assessments involves demonstrating the technique while kneeling on the floor. Furthermore, as I have 2 adult children with handicaps and a series of seizures, I need to be able to be knowledgeable in CPR for their well-being as well. Thank you, Jerry Ann. So yes, CPR is obviously something I'm very familiar with as a healthcare practitioner. I've had my CPR license since I was 15 and I was lifeguarding. And you're right, when they're doing the CPR examinations, you have to demonstrate on the floor. Usually the mannequin is on the floor and you're sitting on the floor, and how you position your body is very important. You have to be able to position yourself directly over the ribs if you're administering chest compressions in order to effectively pump the heart and pump the circulation. So as an amputee, if you're a bilateral below the knee amputee, I think you will definitely have more of an advantage because you can kneel on both knees, and that's essentially how you're positioned. And then as an above the knee amputee, again, your prosthetic knee would be able to tolerate kneeling on a prosthesis. The biggest skill here to practice is how to get up and down off the floor. Okay, so that's what you would need to do. In some extreme cases, I've seen people that they straddle the victim and then they administer the chest compressions that way. So I've seen that in the hospital at times where the nurse or the doctor has to straddle on top of the patient to really give those chest compressions efficiently. But again, I would say to you, if you are becoming CPR certified, and especially if you have children in the home or someone who might need it, has a high risk, practice getting up and down off the floor, because that's the hardest part. Not to mention it's a life skill that as an amputee, you should really strive to learn how to do if that's possible for you. Benny says, wear shorts to get there early, and yes, use a wheelchair if needed. There we go. Sean says, I always wear shorts and I have never had a problem. TSA doesn't even check my leg. Yeah. And I've heard everything from one end to the other on experiences with TSA. So yeah. Yeah. All right, guys, let me just do a quick check over here. All right, guys, I think that is it for today. We did a lot of catching up today, and I really, like I said, I really love being here on Wednesday nights and answering questions and interacting with you guys. So next week, what's next week? Next week is the 17th. We're going to have another general Q&A question. The next big show is going to be October 15th, and I'm so excited about that show. It's going to be with Integrum, so the makers of the Oprah implant system. But what's really near and dear to me is we will be having it at Moffitt Cancer Center. So Moffitt Cancer Center is where I received treatment for breast cancer years ago. So soft spot in my heart. Moffitt Cancer Center is also in the top 10 of cancer centers in the United States, up there with Sloan Kettering and also MD Anderson. So it's a phenomenal cancer institute. And one of their surgeons there is now starting to do osseointegration. So I'm excited to see osseointegration come to my hometown here in Tampa. I'm very excited to be able to be there in person and kind of come full circle. It's going to be definitely a full circle moment for me to be able to have a COSI Talk show live at the place that saved my life so many years ago. So October 15th, you'll be hearing more about it soon. But in the meantime, we will be seeing you guys next week. And again, just a thank you to everybody out there who allowed me to speak tonight from the heart. And thank you for giving me this beautiful distraction for the last hour and a half from some of the things going on in our world right now. So I appreciate that. All right, guys, as always, thank you for allowing me to be a part of your lives this evening. I will see you next week. Same bat time, same bat channel.